up, you guys? My name is Kiara Selena and welcome back to my channel where I make a whole bunch of nursing videos giving tips and tricks for my newly accepted nursing students and current nursing students to help you guys have the smoothest nursing journey. So if you're into things like that, you might want to consider subscribing so that you'll be the first person to get a notification every time I post a video. This video is going to be for my nursing students out there who have never been on clinical rotations, never ever been in the hospitals. You guys have no hospital experience. I know you guys are nervous. I know you guys are scared, and that's completely normal, but I basically wrote down a couple of tips right here on my pamphlet to help you guys have smooth sailing in your clinical rotation. So let's get right into it. So my first tip is to watch videos, and watching videos is good for anything. Like, it's just like the best study method in my opinion. But watch videos that are related to whatever clinical rotation you are about to do. So my first clinical rotation, I mean, I don't really consider it a clinical, but it was one of our rotations and it was basic care. And our basic care book was completed a couple, like 2 or 3 months before we did our basic care rotation. So there was some stuff that I forgot. So I went on YouTube and I basically looked at a whole bunch of videos on how to help with ADLs, how to do showering, bed baths and all of that. Because, you know, it seems easy. You know, we do it to ourselves every day. But when you're dealing with patients who, you know, who aren't able to walk or are incontinent, it's different, you know, and you have to slide them onto, you know, the shower bed, and you know, sometimes you forget things. So just watch videos to kind of recap and refresh your memory so that you'll be a lot more well prepared for your clinical rotation. So my next tip is to sleep. Make sure that you get sleep. I didn't sleep. I was so nervous I couldn't even eat. But if you can, you know, put some meditation music on. I don't know, light some incense or some candles or something in your room, and just try to get yourself at least 6 to 8 hours of sleep before your clinical, because it's gonna be tough. Like, it's gonna be tough. I know that it was tough for me. Like, and I only had 3 patients, I think, and I was pretty much going crazy. So make sure that you get rest. My next tip is to go early. Get there early. If your clinical starts at 7, try to be there for 6:30, 6:15 if you can. And if it's at 6:30, try to be there, you know, 5:45 or 6 o'clock. Try to be there half an hour before, you know, just so that you can, you know, get your coffee and kind of like get yourself into the zone before. Like, don't come late, because it can be overwhelming to kind of just get there, take your jacket off, and have to start right away. You know, if you get there at least half an hour before, you can kind of settle in and zone in before, you know, you're sent off to your patient. Next tip is to take shadowing seriously. I don't know how it works for other students, but for us personally, I think it was like our first 2 or 3 days, we were shadowing a nurse or a nursing assistant, depending on what clinical you're on. But I'm talking for basic care, we were shadowing a CNA. And take it seriously, you know, look at how they do things and time them. Look at, you know, what time they start and what time they finish, so that you know approximately how much time it should take you to get a task done, you know. I know that for my CNA that I was shadowing, it took her like about 15 to 20 minutes to, you know, do a bed bath, get the patient's hair done and brush their teeth and everything and get them ready for breakfast. My first time doing that, I swear it took me almost an hour. So I mean, just take some tips, a little like tips from them. Ask them for advice so that they can share any tips and tricks if they have any. And yeah, take your shadowing seriously. Tip is to ask questions. Do not be afraid to ask questions. You know, like if you have to go in and do a task and you don't remember how to do a task, don't go and, you know, end up messing up your patient because you were afraid to ask, or you didn't want to annoy the nurse or annoy the nursing assistant. No, if you don't understand something, if you don't remember how to do something, do not be afraid to ask questions, because it's better to ask than to hurt your patient, like I said before. And if you're unable to get a hold of a doctor, maybe try speaking to a nurse, a medical student. I know that medical students are usually just as nervous as nursing students when, you know, they're doing their clinicals or whatever. And, you know, they're also students, so you guys can kind of like relate on that level. So if you're afraid to talk to a doctor, maybe speak to a medical student or a resident, and or ask another nursing student, somebody who's in your class who might, you know, remember how to do something. But always ask questions if you don't understand something. You need to really remember that these are people's lives that are in your hands, and the last thing you want to do is end up hurting one of your patients, especially on your first clinical rotation. I mean, yeah, so ask questions. So that's it for the tips that I have to share with you guys. I had some other tips that I could have shared with you guys, but I didn't want the video to be too long, so I basically just took the most important ones and shared them with you. If you guys have any suggestions of any types of videos that you guys would like for me to do, please leave them down below. Don't forget to like, comment, and subscribe, and hopefully I will see you in my next video.